Today, we're diving deep into a fascinating study that sheds light on thrombotic disease in dogs, particularly those suffering from renal proteinuria. As many of you know, renal proteinuria, or protein-losing nephropathy, occurs when the kidney's filtration system is damaged, leading to excessive protein loss in the urine. This condition can make dogs hypercoagulable, meaning their blood is more prone to clotting, which in turn increases their risk of developing thrombotic disease. But what specific characteristics or conditions might further heighten this risk? And do these risk factors differ depending on where the thrombus, or clot, forms, whether in the systemic arterial, systemic venous, or pulmonary circulation? These are the critical questions that this research aimed to answer. By identifying high-risk dogs, veterinarians can administer targeted antithrombotic therapies. The most frequent site for thrombus formation was the aorta, with 20 cases, followed by the pulmonary vessels, with 16 cases. Interestingly, Cavalier King Charles Spaniels were overrepresented in the thrombotic disease group. Compared to dogs without thrombotic disease, those with thrombotic disease had higher neutrophil counts and lower eosinophil counts in their blood, as well as lower serum albumin levels. When comparing the different thrombus locations, the researchers found that arterial thrombi cases had higher serum albumin concentrations than venous thrombi cases and were older than pulmonary thrombi cases. Venous thrombi cases, on the other hand, were older and had higher serum cholesterol concentrations than pulmonary thrombi cases. The researchers identified that Cavalier King Charles Spaniels with renal proteinuria had higher rates of thrombotic disease compared to other breeds. Prior research has noted that this breed is predisposed to arterial thrombosis, especially aortic thrombosis, though not necessarily in association with protein-losing nephropathy. In this study, all 5 Cavalier King Charles Spaniels with thrombotic disease had arterial thrombosis, with 4 of those being aortic.